everyone. Welcome to the Global Learning Conference. We are here now to talk about difficult conversations in ADS and ASD. Welcome to Ireland. Well, I'm not actually in Ireland, but nice to meet you all. So I'm Dr. Anne Brito. I'm a neuropsychologist in Brazil, and my PhD is in integrative therapy. We are here today to talk a little about self-care, mindfulness, and chronic pain, especially pain, thinking about ADS, but what we are talking today are little practices and exercises you can do at home with or without your healthcare professional. But please keep in mind we are talking about exercises and practices that were originally planned by healthcare professionals. So it's not like it's a DIY treatment for ADS or ASD. It's more of an introduction to this word for you. So you can know, you can be aware there are alternatives. Okay, so let's start. So when we talk about chronic pain, we are, of course, talking about emotional problems, emotional distress, because I mean, you are in pain. It's not a pleasant feeling. And this distress the pain brings to you have an impact on your emotional health and your quality of life in general. And we have to understand and recognize the impact is not just physical. When we talk about a chronic pain issue, a chronic pain disorder, here I'm talking about fibromyalgia, can be one of the comorbidities we talk about, but today specifically we'll focus about ADS. And when we talk about ADS, it is an issue that compromises the quality of our tissues as a whole. Our body is compromised. So our muscle tissues, our bone tissues, they are not the same quality. They don't have the same resistance as someone that doesn't have this disorder. And the low quality of these tissues, they will have an impact on your movement, on your body function as a whole. I mean, if your ligaments are not okay, you need to do surgery to recorrect the position of your organs, and your joint will not have the same quality. Your movement will have more impact on your knees, for example, on your feet, that won't have the same resistance that it should be. So everything in our body, it is affected. And of course, that causes pain. It causes negative sensation on your body. It's not exactly talking about just pain, but uncomfortable. The movement is uncomfortable. The stretching of your members is weird. Is not how it should be. You move, your movement will be perceived as different, because we compensate. If your left knee is not okay, you compensate using your right knee more. So in that, by consequence, will impact on your right knee, and then both knees are not okay, and yada yada. So basically, what we're trying to say here is I say our a lot because I'm an ADS patient too. So our life as a whole is impacted by this disorder, and pain comes with it. The chronic pain is literally, as the name says, it's chronic. It won't go away. The medication for it won't just solve it. It can mediate a little, but it's not a cure, and it's not a treatment. So when you are constantly in pain, it's common sense that comorbidities as anxiety and depression and an increase in your stress levels, they are comorbidities. Comorbidities means diseases that comes from another one. So if you're not an anxious person by your nature or by your life, the chronic pain can cause that. It will especially damage because these emotional situations as negative emotions, they can cause the production of cortisol. And cortisol is a substance that is naturally supposed to be on our body, but it's not supposed to be that high. It's like cholesterol. We should have, but not that much. So it will increase the inflammatory process. It can even start new ones because it's a substance that can trigger that. And then we'll have other consequences. That's why we have a lot of comorbidities along with ADS. It's very rare that you only have ADS. Normally, you have 1, 2, 3 comorbidities because of it. Also, we have the insertion of adrenaline, and adrenaline causes the tension of your muscles and will also make you tight your joints because it's preparing you for a fleeting mechanism. So basically, when you have high adrenaline on your body understands that you're in danger. You have to flee or you have to fight. That's why your muscles will become tense. Your knees will prepare to run, your legs, the body flow and heartbeats will also be impacted by it. Because as I said, if you're preparing to run, you're preparing your body to run, your body flow will go for your legs so you can have more speed. That's basically how it works. And as a whole, it's not a pleasant feeling. If you have your body flow deviated to one part, of course, it means another parts won't have that much body flow. So as an example, you can't think straight, your blood pressure can go very high or very low, depending on your reaction, of course. And as I said, it's not pleasant. It's uncomfortable for you. And as we talk about cortisol levels, if it's a chronic state, as it is for most anxious people, it can impact the quality of bone and muscle tissues. As I said, this highness on adrenaline and cortisol, they make your muscles tense, then you release and tense and release. And there is less of, how can I say? Let's say shelf life. You're decreasing the time you have with a quality body. Your body will basically age faster. And for us, I mean, I'm a 36-year-old, but I feel like 80. I don't know about you people. I feel like an 80-year-old lady. So if I keep decreasing the quality of my body, soon I'll feel like 100 years old. And all that because of my emotional health. So what is mindfulness? Mindfulness is a base treatment that was created to reduce stress level. It's a mix of therapy, psychological therapy with meditation therapy. So it has a lot of inspiration on Buddhism, on mantras, on specific audio files that you can trigger certain, how can I say that? I don't like saying it will trigger certain waves in your brain, but it's very like it. Because when we say trigger brain levels or brain waves, we are talking more about neurofeedback. And it's not a neurofeedback technique, but it's very similar to that. The effect is very similar. So you could say it's a DUI neurofeedback. Okay, but it's not the same, but you can achieve level results. So it was originally designated for stress management. And today we use a lot of chronic diseases because, as I said, most of them don't have a treatment yet. And we deal with damage control. It's already in testing, online delivery mindfulness. It's clinically significant, sorry. And even if you go to an online therapist, it can reduce your pain intensity and can improve your quality of life. We have some studies today, 7 that I could find, and all of them have very positive outcomes. The patients in all of them related some form of improvement, some form of better quality of life after the treatment. But of course, the person-in-person therapy, it was a little better, not that much, but we have better results because you can correct some postures, you can correct your breathing better when you have the person in front of you. By camera, it's very hard to monitor your breathing, to monitor your posture, because as you're seeing me right now, you can only see my top body, so you can't control my breathing, for example. That's what an online therapist will see of their patients. So take that in mind when you choose what form of therapy you want to do. Some examples of mindfulness, we call this structured mindfulness because they have a script for you to follow. Body scan meditation, sitting meditation, and walking meditation. I chose these 3 main treatments because you can do them in your home, you can do them in your work. You need 5 to 15 minutes to execute an exercise. So you can, even as I'm speaking, you or the next speaker, you can sit 5 minutes and execute one of these exercises. So it's excellent for on-the-go treatment. That's why we say you don't need a therapist for it. The job of the therapist to teach you how to do this, and then you can do it by yourself later. Body scan meditation, it's very simple, really. You lie on your back with extended legs, put your arms in your side, your palms facing up, and you try to focus your attention in each part of your body. Go from toe to head to toe. Try to focus on each part one by one. Perceive your body, perceive how you feel, where it hurts, why it hurts, what's going on with you. When you do that, you'll be aware of any sensations, emotions, thoughts. And if your thoughts wander, if you can't focus right now, that's not a problem. Let your thoughts go, and then they will come back. But always let them go and try to come back until you finish your exercise. It's that simple. When you go to the sitting meditation, we have basically the same exercise, but we'll change your posture. You sit with your back straight, feet on the floor, hands on your lap, breathing through your nose, you focus on your breath, moving in and out of your body, on your nose, out of your body. When you do that, you try to concentrate on your breathing, basically, because your body is not in a natural position, so you can perceive much. Again, if your thoughts wander and if anything interrupts you, you can always resume your focus on breathing as long as you are available. Again, it's that simple. And we have the walking meditation. This you try to locate a quiet place for you to walk a little, not that big, try to 6 meters. It can be around your house, around your room. You can walk in circles. The main point here is for it to be quiet, for you to be alone, so you can concentrate on your own body. You will start walking slowly, focusing on the experience itself, on your movements, on your body, how you feel standing. And then each movement you do when you walk, the movement of your legs, the movement of your arms, how you move your head, your posture. And basically, it comes back to your thoughts. If they wander, if you feel not in the moment, let it go and then come back. The main focus here in all these exercises is let's focus on ourselves. Let's focus on our body, on our breathing, so we can divert the negative thoughts, the negative feelings away from the pain and back to the neutral sensations our body can provide us. If you feel any part of your body that hurts, that is not okay, take note of that and move on. Try not to focus on the pain. You focus on your body as a whole. Also, your thoughts will wander and come back, of course, but with practice, with doing it again and again, you will perceive that this will happen less and less frequently. It's not typical for it to keep happening. Sorry. So if you have much problem with focusing, with this kind of exercise, because they are very introductory exercise. That's why I said the therapist will just teach you with levels of difficulty, of course. But if you really have problems with this kind of starting points, it would be nice to evaluate how your attention levels go, because that's how we work with ADHD patients too. We use a lot of this exercise to help them improve attention. So even for mental health care and other disorders, we recommend this kind of exercises. So if you feel comfortable, evaluate your attention levels. You notice improvement of your cognitive resistance too. And basically, as a whole, you feel better. Not less pain, that's not our objective here, but you feel more comfortable on your own body. Okay, so you have to practice daily is the ideal here. Be aware of where you are and what you're doing. Try to stay in the moment, as I said. Let the patient wander, but come back. Cut yourself some slack. Don't try to be so rigid with it. That's not the point. And take some time to be, just to be yourself and stop criticizing yourself, stop having negative thoughts about yourself. Just be. Just exist on the world right now. And I appreciate very much you coming today. Thank you for listening to me. and I'll be very happy to join you on the Key and Rave soon. Have a nice day.